Thank you for listening to Depictions Media Radio.
Bonjour tout le monde. Good afternoon, everyone. C'est un plaisir d'être ici avec vous aujourd'hui. Et maintenant, nous allons commencer avec Dr. Howard Njoo.
Merci beaucoup. Thank you very much. Today, I want to briefly discuss the efforts that public health authorities and individuals are taking to keep COVID-19 activity low while striving to limit the unintended consequences of the pandemic. Aujourd'hui, je voudrais vous parler brièvement des efforts que les autorités de santé publique et les gens font pour que l'activité de la COVID-19 se maintienne à un niveau faible, tout en s'efforçant de limiter les conséquences non voulues de la pandémie. But first, here are the latest numbers. There have been 111,124 cases of COVID-19 in Canada, including 8,858 deaths. 88% of people have now recovered. Labs across Canada have tested over 3,573,000 people for COVID-19 to date. Over the past week, an average of 42,000 people were tested daily, with 1% testing positive. On a signalé 111 124 cas de la COVID-19 au Canada, dont 8 858 décès des personnes infectées, 88% sont rétablis. À ce jour, des laboratoires partout au Canada ont fait passer un test de dépistage à plus de 3 573 000 personnes pour la COVID-19. Au cours de la dernière semaine, nous avons testé en moyenne 42 000 personnes par jour, dont 1% ont reçu un résultat positif. Jurisdictions across Canada are continuing with gradual reopening plans while closely monitoring the local epidemiology of COVID-19. We expect to see some local clusters of infection as we move forward. Where new cases and outbreaks emerge, public health authorities aim to respond quickly to minimize the spread and impact of COVID-19 while carefully considering the health and societal impacts of control measures in their communities. Les administrations à l'échelle du pays poursuivent leur plan de réouverture graduelle tout en surveillant de près l'épidémiologie de la COVID-19 localement. Nous nous attendons à voir quelques foyers d'éclosion locaux en cours de route. En présence de nouveaux cas et des nouvelles éclosions, les autorités de santé publique visent à répondre rapidement en vue de minimiser la propagation et les effets de la COVID-19 tout en examinant attentivement les répercussions sanitaires et sociales des mesures de contrôle dans leur collectivité. Limiting disruptions to health, social and other support services throughout the pandemic is a priority for all jurisdictions. These services are needed to protect and promote the overall health and well-being of individuals and communities. They include regular health visits for the management of chronic diseases, healthy development, and vaccinations. They also include mental health and substance use supports. Limiter les interruptions des services de santé, des services sociaux et d'autres services de soutien tout au long de la pandémie est une priorité pour toutes les administrations. Ces services sont nécessaires pour protéger et promouvoir la santé globale et le mieux-être des personnes et des collectivités. On parle entre autres des rendez-vous médicaux réguliers pour la prise en charge des maladies chroniques, le développement sain et la vaccination. On parle aussi des soutiens en matière de santé mentale et de consommation de substances. We must maintain our resolve to provide these life-saving supports to loved ones and members of our communities who use drugs. Tragically, the pandemic is compounding the deadly and ongoing public health crisis of opioid-related overdose and deaths. Access to treatment and harm reduction services are essential to stop fatal overdoses from claiming more lives across the country. Nous devons demeurer résolus et à fournir des soutiens vitaux à ceux qui nous aimons et aux membres de nos collectivités qui prennent de la drogue. La pandémie aggrave tragiquement la crise de santé publique mortelle et continue de surdoses d'opioïdes et des décès associés. L'accès à des soins et à des services de réduction des méfaits est essentiel pour éviter que des surdoses mortelles ne tuent d'autres personnes au pays. I also want to take this opportunity to remind Canadians that a range of mental health and substance use supports are available at no cost through the Wellness Together portal, which you can access at ca.portal.gs. Je voudrais aussi profiter de l'occasion pour rappeler aux Canadiens qu'il existe toute une gamme de soutien gratuit en matière de santé mentale et de consommation de substances sur le portail espace Mieux-être Canada à ca.portal.gs. Finally, we all have a role to play in keeping COVID-19 under control in Canada and to thereby limit disruption to other health and social services. Take precautions to reduce your risk and prevent spread to others. Stay home and away from others if you are sick with even mild symptoms. Keep 2 meters apart from others who are outside of your bubble of close contacts. Wash your hands often with soap and water for at least 20 seconds and carry hand sanitizer with you to use when you are outside of your home. Cover your coughs and sneezes with a clean tissue or your sleeve. Wear a non-medical mask or face covering when you can't keep 2 meters apart from others and where mandated by local authorities. Protect vulnerable family, friends, and contacts by finding virtual ways to connect and support those who are at higher risk for severe outcomes of COVID-19. Enfin, nous avons tous un rôle à jouer pour maîtriser la COVID-19 au Canada et pour limiter l'interruption des autres services de santé et services sociaux. Prenez les précautions nécessaires pour réduire les risques et prévenir la propagation. Restez à la maison et à l'écart des autres si vous êtes malade, même si vos symptômes sont légers. Gardez une distance de 2 mètres avec les personnes qui ne font pas partie de votre bulle de contact étroite. Lavez-vous les mains souvent avec du savon et de l'eau pendant au moins 20 secondes et ayez sur vous de désinfectants pour les mains quand vous n'êtes pas à la maison. Toussez ou éternuez dans votre manche ou dans un mouchoir de papier. Portez un masque non médical ou un couvre-visage quand vous ne pouvez pas rester à 2 mètres des autres et quand les autorités locales vous y obligent. Protégez les membres de votre famille, vos amis et vos connaissances qui sont vulnérables en trouvant des moyens virtuels de communiquer et de soutenir les personnes les plus à risque de subir les conséquences graves de la COVID-19. Avoiding high-risk settings and situations will also help keep you and your loved ones safe. Avoid or strictly limit time spent in high-risk situations and settings, including closed spaces with poor ventilation, crowded places with large numbers of people gathered, close contact where you can't keep an optimal 2 meters physical distance apart from others. Éviter les milieux et les situations à risque élevé vous aidera à vous garder en sécurité ainsi que vos proches. Évitez les milieux et les situations à risque élevé ou limitez au minimum le temps que vous y passez, notamment le bec. Des endroits bondés où se rassemble un grand nombre de personnes, les contacts étroits où vous ne pouvez pas vous tenir à 2 mètres des autres, des espaces clos mal ventilés. I encourage Canadians to keep up with these tried and true public health measures. We have experienced losses, but we must not lose hope. We must renew our commitment as individuals and communities to stop COVID-19. By working together, we can keep COVID-19 activity low. J'encourage les Canadiens à continuer d'appliquer ces véritables mesures de santé publique éprouvées. Nous avons perdu des vies, mais nous ne devons perdre espoir. Nous devons renouveler notre engagement en tant que personne et en tant que collectivité pour freiner la COVID-19. Ensemble, nous pouvons maintenir l'activité de la COVID-19 à un niveau faible. Thank you. Merci.
Merci beaucoup, Dr. Njoo. And maintenant, thank you so much for being here today and good afternoon. I will begin, as usual, by expressing my thanks to all Canadians who are helping our country manage through this challenging experience. Thanks to you, your respect for public health guidance, and your genuine concern for your fellow citizens, we are beginning to see a gradual easing of restrictions across much of this country. Sans aucun doute, nous avons fait d'énormes progrès dans la lutte contre la propagation de la COVID-19. et nous devons rester vigilants. Et c'est grâce à vos efforts que nous sommes maintenant en mesure de discuter de la meilleure façon de relancer en toute sécurité nos activités quotidiennes et l'économie. From the outset, my department has been focused on aggressively purchasing personal protective equipment in a highly competitive global environment. At the same time, we at Public Services and Procurement Canada have made great strides in diversifying and establishing multiple supply chains in order to better adapt to global volatility surrounding much sought-after commodities. We have also seen businesses from across this country answering the call to help supply life-saving PPE, much of which is being made right here at home to fight COVID-19. We have signed 55 contracts with domestic manufacturers, and 44% of our overall contracts by dollar value are with Canadian manufacturers. Companies such as Jacobs & Thompson of Toronto, Westport Manufacturing of Vancouver, and Stanfields of Truro, Nova Scotia have retooled their manufacturing lines, rehired staff, and created new jobs to give an economic boost to regions across Canada while providing key supplies. These efforts have been integral in our fight against COVID-19. Because of these efforts and our two-pronged procurement approach, we are seeing results. This morning, our 101st chartered flight carrying PPE arrived home. To date, our government has received face shields in the amount of $36.7 million, gloves in terms of pairs, $185 million, gowns, nearly $46 million, hand sanitizer in excess of 11 million liters, N95 and KN95 respirator masks, $50.6 million, surgical masks, $265 million, ventilators, 409. All of these supplies are in addition to those procured directly by provinces and territories for their respective healthcare systems. While our previous reporting has focused on those supplies destined for frontline healthcare workers, these numbers today are a reflection of the total amount of supplies received to date, a point on which I will expand further right now. In particular, what I would like to do today is to set forth the various streams of personal protective equipment with which our department at Public Services and Procurement has been engaged. First and foremost, our top priority has been and continues to be procuring equipment and supplies for our frontline healthcare workers that we have ordered on behalf of the Public Health Agency of Canada for provinces and territories. We are and will continue to be committed to their health and safety. Of course, healthcare workers are not the only essential workers in need of these goods. Afin de redémarrer notre économie, des millions de travailleurs canadiens dans les secteurs clés des services essentiels doivent pouvoir retourner au travail en toute sécurité, tout en se protégeant eux-mêmes, leurs collègues et les Canadiens qu'ils servent. Second, as the government department responsible for federal procurement, PSPC is also engaged in ensuring that federal departments and agencies have the PPE that they require to safely reopen. In this procurement stream, we are purchasing a wide range of PPE for non-medical face coverings and face shields to disinfectants and hand sanitizer to support everyone from Parks Canada to border services. As more businesses and other organizations reopen, demand for PPE, non-medical masks, and disinfection products to keep workers safe is increasing. And while the market is catching up to this demand, finding PPE can still pose challenges. Last week, Prime Minister Trudeau announced the Safe Restart Agreement, a federal investment of more than $19 billion to help provinces and territories safely restart their economies and make our country more resilient to possible future waves of this virus. I am pleased to announce today a third stream for PPE. In addition to PPE for frontline healthcare workers and other government departments, that we call the Essential Services Contingency Reserve. This reserve is part of the Safe Restart Agreement's commitment to supporting essential services requiring access to PPE. This will be a temporary reserve of critical supplies and equipment that can be purchased at cost by essential services sectors that have been unable to acquire these items elsewhere. J'ai le plaisir d'annoncer aujourd'hui que nous mettons sur pied une réserve d'urgence pour les services essentiels dans le cadre de l'entente visant à appuyer les organisations de services essentiels qui ont besoin d'accès et de l'équipement de protection individuelle. Il s'agira d'une réserve temporaire d'équipements et de biens vitaux dont pourront se prévaloir les organisations de services essentiels qui n'ont pu se procurer cette marchandise ailleurs. The contingency reserve that I am announcing today will bridge urgent short-term gaps for eligible organizations and businesses to avoid any significant disruptions in services that they provide to Canadians. In many situations, organizations can now source the PPE they need. However, there will be situations where existing sources of supply are simply unavailable, delayed, or disrupted. In those cases, the Essential Services Contingency Reserve stands as an emergency backstop. We have teamed up with SCI Logistics and its network of warehouses across the country to fulfill online orders from eligible organizations and businesses that find themselves urgently requiring a short-term supply of PPE. SCI is the warehousing subsidiary of Canada Post, and it will leverage Purolator for deliveries. Detailed information on who is eligible to use the reserve and how to apply will be made available shortly on our website. Essential services workers across the country are committed to Canadians, and we are thankful for their contributions. Through the Essential Services Contingency Reserve, the government is making sure that these organizations can continue to operate. Canadians can rest assured that they will continue to receive the essential services on which they depend as Canada continues to recover from this pandemic. The Essential Services Contingency Reserve breaks new ground in terms of the broad provision of PPE, and I am so pleased to be able to announce it here with you today. In closing, while the nature of the pandemic has been changing, we must ensure that Canada is prepared for any eventuality in the short and the long term. That has been our strategy from the beginning, and it continues to be our strategy today. We will continue to work with our partners in industry as well as those providing essential services in order to get through this pandemic together. Merci beaucoup. Thank you so much. Maintenant, nous pouvons avoir vos questions.
Thank you, Minister. Thank you, Doctor. Nous commençons la période de questions maintenant. We'll move to the question period. Nous commençons au téléphone avec des questions de là, puis après ça, suivi par les questions de la Chambre. We'll start with the phone before moving to questions from the room. Operator, may we have the first phone question, please?
Thank you. Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. The first question is from David Youngren from Reuters Canada. Please go ahead.
Yes, thank you. Thank you. Dr. Njoo, you have, there have been several major cities, including Ottawa, have recorded a spike in cases in the last few days. Is this something of concern to you? Does this fall into the parameters that you were expecting would happen as the economy began to reopen?
Thank you very much for the question. Yes, it's something that we've noted at the national level, but also obviously in the individual provinces and territory, this uptick or this sort of increase in cases. As I mentioned, I think earlier, we were averaging about 300 cases a day. With a 7-day rolling average, and then more recently that's increased to 350, and now we're in a neighborhood of about 460 cases per day for the last 4 days or so. So that is of concern. We've done some analysis. I think the provinces and territories have obviously done their own analysis, and what we're noticing, and it's something that I do want to highlight, is that it seems that the vast majority or the increase in proportion of cases is among what we call young adults. Whereas, for example, back in May, it was a smaller percentage, maybe a third of cases across the board in Canada. More recently, it's been about 55%, and that is concerning. And so there are a number of reasons to explain this. Certainly, I think the reopening of businesses is one factor, but I think I'll take a step back. I think if I can call it sort of the three factors, the first one being fatigue. I think that, young adults as part of the general population, I think everyone's been tired, after spending the winter, cooped up, and now with the nicer weather in the summer, I think people just want to get out. So I think there is a fatigue factor in terms of trying to maintain all of those good public health measures, the ones I just mentioned, the physical distancing, washing your hands frequently, staying home when you're sick, wearing a non-medical mask or face covering if you aren't able to maintain the 2-meter distance and so on. So that's number one. Number two, I think among the young folks, I would call it the invincibility factor. I think young folks, I was young once, I think at a certain age, you think that you can get away with anything, that, you're basically able to, deal with anything that comes and there won't really be any major consequences. And that I think is a tough one because we have noted, and I think the young people have also noticed that by and large, even though their risk of actually being exposed to COVID-19 is the same as anyone else, the fact is that certainly they appear to have less of a probability of having a serious health consequences compared to, let's say, older age groups and also those with other underlying medical conditions. And so that's one thing that is, I think, playing on their minds maybe. The other part also is that many of the young folks, I think, are also having a very few or mild symptoms, and some are even asymptomatic. But that's where I think the challenge is, because even if they have mild symptoms or are asymptomatic, the fact of the matter is that they're part of our society. And so, they go to work. They obviously have older parents and grandparents, and certainly there's a risk of transmitting the virus to those who actually would be at higher risk of severe consequences. So that, I think, is another factor. And then I think thirdly, there's the issue of what I call, as you pointed out, the reopening, sort of getting to the new normal factor. Provinces and territories, everyone's trying to reopen at a very, I think, a prudent pace, slowly opening up bars and restaurants. But everyone recognizes that we would expect to get, clusters of cases, and it's really for the authorities at a provincial and local level to be able to monitor the situation, see what happens if there is a cluster, to be able to get on top of it very quickly with a good capacity in terms of early testing of potential cases, then making sure they're isolated and managed appropriately, doing the contact tracing and so on. And so what's happening then is that certainly some of the cases with the young folks, but also people in other age groups, are associated with the opening of bars and restaurants. But I've also noticed, and I think it's also been noted by authorities in the provinces and territories, that many of the clusters of cases among the young adults are also associated with indoor parties. And I'm thinking there, and I don't know, I don't have any actual proof, but the thinking might be that as, bars and restaurants and society opens, that is maybe in some ways a signal for people to think, oh, okay, I can let go, things are returning to normal, and therefore they are getting together, indoor parties, probably with lack of social distancing and so on. So there are lots of factors in play, and we're certainly keeping an eye on it, and I think across the country, we need to redouble our efforts in terms of reaching all Canadians, including young folks. I think Canadians have made tremendous sacrifices, and we've succeeded overall in flattening the curve. But that success is fragile, and it only takes a few sparks and so on to backslide and create, obviously, the situation we don't want. Thank you.
Do you have a follow-up?
And secondly, do you think, therefore, that the authorities that have opened up bars should scale down the plans or freeze any more bar openings until you can assess the exact extent of the spread linked to bars?
I think really that decision is really left to local authorities, because they actually, as they say, have the best sort of pulse of the situation, know what's actually going on in their jurisdictions, certainly tracking the local epidemiology, getting a sort of a handle on the cases that are detected, doing the contact tracing and determining the factors involved. Certainly I've heard from authorities across the country that should there really be, I think, a large cluster or let's say sustained transmission that might be associated with a certain setting, in this case maybe bars and restaurants, then certainly I think they're prepared to make adjustments as necessary.
Thank you.
Thank you.
On peut suivre la prochaine question téléphonique, s'il vous plaît.
So if you dial in half an hour ahead of time, you get the first question. Whereas the PM, you dial in 46 minutes ahead of time, you get the third question. Okay, I'm fine. If I need any more, I'll call you, but I think that's it.
Thank you. The next question, la prochaine question est de François Carabin du Journal Métro. À vous la parole.
Oui, bonjour, m'entendez-vous bien? En tout cas, ma question s'adresse à Dr. Njoo. Écoutez, Dr. Njoo, vous avez mentionné plus tôt le taux de positivité des tests au Canada. Je pense que c'était autour d'1%. Au Québec, il serait plus élevé. Là, aujourd'hui, on a un nouveau record pour le mois de juillet de 180 nouveaux cas au Québec. Est-ce que la situation dans la province du Québec vous inquiète plus qu'ailleurs au pays?
Moi, je peux vous dire que oui, la situation à travers le pays, on suit de très étroite les situations dans chaque province et territoire, incluant le Québec. Je pense que les autorités de santé publique au Québec ont fait un bon travail, aussi tous les Québécois et Québécoises, parce que aussi comme avec le reste du Canada, on a réussi à aplatir la courbe. Mais c'est toujours quelque chose, on peut dire c'est un succès, c'est fragile. Et comme vous avez mentionné, c'est très important pour les autorités de santé publique à l'échelle locale de suivre de très étroite c'est quoi la situation, l'épidémiologie dans leurs administrations, offrir le dépistage de laboratoire comme c'est nécessaire au fur et à mesure, suivre qu'est-ce qui se passe actuellement dans les bars, les restos. Ce qu'on voit maintenant que le taux de positivité, c'est au Québec, c'est pas mal proche, c'est un peu plus que 1%, mais c'est un bon taux de positivité, et certainement le nombre de tests dépistage offerts au Québec, je pense que c'est comme environ 14 000, je pense, par jour, c'est bon, et sûrement il y a des éclosions. Moi, je suis au courant avec qu'est-ce qui se passe à l'heure actuelle en Montérégie avec l'éclosion, je pense liée au bar-restaurant, mais aussi des fêtes à l'intérieur, exactement comme j'avais dit. C'est une situation parmi des jeunes adultes. Il faut vraiment, je pense, que redoubler peut-être nos efforts, avertir, sensibiliser toute la population, aussi des jeunes adultes. Merci.
Merci. En suivi, ma question s'adresse cette fois-ci à la ministre Anand. Vous avez mentionné une demande assez forte déjà aujourd'hui pour l'équipement de protection individuelle, notamment en raison de la demande dans les commerces. À ce moment-là, comment on se prépare pour avoir assez d'équipements de protection dans l'éventualité d'une deuxième vague, là, si vous nous dites qu'aujourd'hui déjà, il y a une demande importante?
Merci beaucoup pour la question. Alors que nous redémarrons progressivement notre économie, comme vous avez dit, nous nous engageons à soutenir un redémarrage sûr et un retour au travail en toute sécurité pour les fournisseurs de services essentiels dans tout le Canada, en établissant un filet de sécurité temporaire pour fournir un accès d'urgence à court terme à l'équipement de protection et à d'autres fournitures essentielles sur la base de recouvrement des coûts. Nous devons avoir multiples chaînes d'approvisionnement qui opèrent à la même fois et nous allons planer pour le court et le long terme aussi. Merci beaucoup.
Merci. And just as a quick reminder for everyone, we are to pass the greatest number of journalists as possible. We're sticking to one question, one follow-up. Un petit rappel que c'est une question suivie, juste pour qu'on peut passer le plus grand numéro de journalistes que possible. Operator will take another one from the phone before going to the room, please.
Thank you. The next question is from Kelly Grant from the Globe and Mail. Please go ahead.
Hi, thanks very much for taking my question. I wonder if you can comment a little bit more on the uptick in cases, and particularly on some comments that Bonnie Henry made yesterday concerning the fact that potentially that province is on the verge of some explosive growth there. Are you concerned about the possibility for explosive growth across the country with where we're sitting at the moment?
I'm taking that questions for me. It's Dr. Njoo. Certainly, yes. We continue that very close communication. Certainly, the Special Advisory Committee with all of the Chief Medical Officers of Health, myself, Dr. Tam, we meet on a regular basis. The situation in British Columbia is concerning. I think it's a similar situation in many of the other provinces. For example, Alberta, Quebec as well. As I mentioned, the uptick is really associated, I think, with outbreaks in young adults. I think in British Columbia, I think Dr. Henry mentioned that there was, I think, quite a cluster of cases associated with Kelowna in terms of bars and restaurants and indoor parties, etc. And so, as with other parts of the country, we're keeping a close eye on it, on the situation. And I think, as I mentioned before, all the sacrifices, all the great efforts that Canadians have made to date in terms of flattening the curve, we need to be mindful that that success is fragile. That it only takes a few sparks and sort of people letting go and not sort of keeping their foot on the gas, so to speak. That we could backslide and unfortunately. Return to situation as we had several months ago. So certainly, Bonnie, Dr. Henry's assessment of situation, I think, is very valid, as it is in the other provinces and territories. And I think maybe one of the things that we might be discussing at our Special Advisory Committee is that are there maybe specific strategies that we could be doing across the country as a whole, in addition to what obviously what's being done in each province and territory, sort of in their own jurisdiction.
I might just add to that as well, because what we're doing here today in terms of announcing PPE for essential workers is really an attempt to curb potential increases in the virus and the numbers that we're seeing as our economy restarts. So as Dr. Njoo alluded to, their bars are reopening, playgrounds and restaurants, and it's important for essential services and workers in those areas to be able to access PPE. And so the announcement today that I've made relating to essential service workers is really an attempt to address PPE challenges as the economy restarts and reopens. It's quite complementary to the remarks that Dr. Njoo just made.
Do you have a follow-up?
Yeah, I was wondering, Dr. Njoo, if I could ask about Alberta, I believe, is scheduled to announce what they're hoping to have as a full-time return to school in the fall. These recent increase in cases, how do you think they will affect efforts to reopen school in the fall?
It's certainly something that we need to keep an eye on, because I think in terms of the issue of reopening schools, I think one of the important factors that needs to be taken into account is obviously the overall sort of activity of the virus in the general community. So if the virus circulating level is quite low, then certainly the approach or strategy in terms of reopening schools, I think, would be much different compared to if there was widespread transmission in the community. Then I think there would be an increased level of risk in terms of opening schools, just because there's lots of chains of transmission and uncontrolled, I think, community transmission. So that's something to keep in mind. If the situation continues to be stable in Canada and we have an overall low level of transmission, then the question of opening of schools, I think, is very much in play. We're having active discussions at the Special Advisory Committee. We are actually, I think, posting guidance in terms of post-secondary educational institutions that I think will be of use, obviously, at the provincial territorial level. And we're also now looking now at the issue of guidance for schools, let's say kindergarten to grade 12. And I think the evidence is still coming in. The scientific evidence is accumulating around the world. We certainly can learn from the experiences from around the world in other countries that have also, quote, opened up their schools. We've also, I think, have the benefit of learning from the experience of both Quebec and British Columbia that had sort of a limited opening of their schools in the spring, and seeing how their experiences turned out and what they may tell us moving forward for the fall. One of the things that's very interesting to look at, and it's just based on sort of the scientific evidence that I've been able to review myself, is the ability of children to transmit. We all know that very young children, certainly from the evidence I've seen, don't tend to be very ill, if at all, and also don't seem to transmit to the adults. And maybe it's a bit facetious, and one theory might be is that they're so short that it's hard to transmit and have the aerosols cough up to hit the adults in the room. But be that as may, it looks like overall the risk is low, and so that's something to keep in mind. However, I think other data and evidence shows that older kids, once you're, let's say, over the age of 10 or 12, into your adolescent teenage years, then the risk of transmitting may be closer to other young adults, and that's something that maybe needs to also be taken into account. So I think one of the things that jurisdictions need to look at as well is that it might not be a one-size-fits-all. There might be a different approach for elementary schools as opposed to high schools and so on, and all that's part of the mix. And there's still, I think, some time to plan for it, but certainly I think we need to keep a close eye on the situation and also look at the best evidence to guide the approach in each of the provinces and territories. Thank you.
All right, thank you. We'll now take 3 questions from the room, please. Will you please identify yourself and your organization?
Stephanie Lewis, the Canadian Press. My first question is for Dr. Njoo, and I want to circle back around to this idea of opening up bars and restaurants. If we take a look back to sort of the history of the virus, right? I mean, people knew right away, for example, that on a cruise ship, which was a closely contained environment, it spread like wildfire. And from there, we saw it jump to other closely contained environments, such as seniors' care homes, and then we saw it among temporary foreign workers. And in all of those cases, it could be argued that we reacted too slowly to curb those outbreaks. So if the early signs now are pointing to bars and restaurants as a particular potential weak spot, why allow them to keep opening? Why not act now and shut them down?
Thank you for the question. I certainly what I can give you is a public health perspective, and I think what I've been mentioning up to now is that it's a delicate balance. Certainly the public health imperative, our focus right now obviously is on COVID-19, but even in the public health space, we recognize there's lots of unintended consequences in terms of the impacts on other chronic diseases, mental health, the opioid crisis, and so on. So that's something we need to keep in mind. Moving forward, we also recognize that, we need to, at some point, reopen our society. There's also been a tremendous economic impact. I think we all understand that. And so the tricky part really is trying to find that balance as we slowly, as a society, figure out how we move forward with the appropriate amount of caution in terms of various sectors, in this case, be the hospitality industry, bars and restaurants, but also by putting all the other measures in place. You were mentioning things like the Diamond Princess and, long-term care facilities. I think the science has even evolved beyond what happened in those days. For example, the role of asymptomatic transmission, the effectiveness of at a population level using face coverings and face masks to stop potential small droplets. All those weren't maybe known at the time, but as the science has evolved, they've now become part of our our suite of tools to help diminish or lower the risk of transmission. Having said that, I think I mentioned before that it's all a matter of what I would call risk tolerance and risk management, both at a population level, but also at a very individual level. So, for example, if you're talking at a population level, from a public health perspective, we can give guidance, we can give you the latest scientific evidence in terms of what the transmission risk, et cetera, and so on. Governments certainly have a role to play in terms of putting certain measures in place using maybe regulatory or legislative tools. For example, some governments have put in place sort of the mandatory use of face masks indoors in public spaces. So that's at a population level. But then at an individual level, you have to do your own individual sort of risk assessment and look at the risks and benefits of whether you want to go into a bar. You have the evidence. Some people, their risk tolerance might be said, no, it's not worth it. Maybe you're an older person. Maybe you've got some underlying medical conditions and you don't feel comfortable going into a bar. Some other individual, based on sort of their own analysis of the risk and benefits, they may say, hey, I'm going to wear my face covering. I'm going to have my hand sanitizer. I'm only going to go with my close group of friends. We're going to take a table away from everyone else with good physical distancing inside the bar. And that might be reasonable for them to take. So it's really, I think, a combination of all those factors, and it's not something for me to personally say, well, yes, you have to do this, close the bars and restaurants. It's much more complex than that. Thank you.
Thank you. My follow-up is for Minister Anand. I'm hoping to double barrel it because, one, you seemed to suggest a minute ago that bars and restaurants would be considered essential services under this procurement plan. I mean, how do you equate... How, in your view, are they essential services? And also, if they're not forced to be wearing masks, what difference does it make if they have access to this reserve or not?
Thanks for the question, and the clarification should be made that essential services refers primarily to sectors such as the food or agri-food business, or the transportation sector, where we have people and businesses and organizations working to ensure that our society and economy in particular can survive. And so I did not mean to imply that that bars and restaurants fall into those categories. But what I did mean to imply is that in my mind, PPE is a bridge to the ability to reopen, regardless of the sector. And so, as Dr. Njoo mentioned, if you seek to go to a restaurant, one of the questions you will likely be asking yourself is, to what extent are the owners and the servers wearing face coverings and practicing physical distancing and having things like hand sanitizer available? And so very much when I think about PPE, regardless of the context, it is in the sense that it can be a bridge to allow us to do things that we were not able to do in March and April when we were all staying at home and trying to watch our curve flatten. Thank you.
Hi there, Rachel Haynes from CTV National News. My question is for Dr. Njoo. Very similar to my colleague Steph's about not shutting down bars and restaurants. You did say earlier that having these open are sending a signal to young adults that some activities may be okay. You also, in your answer, brought up risk tolerance, but you also stated that one of the factors that's driving this is that young people think that they are invincible, so may have a different risk tolerance there. How is this upwards curve that we're seeing among young people, how are we going to bring that down if we allow bars and restaurants to remain open? And are you comfortable with this uptick continuing if these bars and restaurants stay open and unsafe activities continue?
Thank you for the question. So first of all, in terms of the uptick, yes, we're obviously, I think, across the country, and myself, we're concerned and we're monitoring closely in terms of hopefully it's just a temporary blip. We will obviously have to see what happens in the days and weeks to follow in terms of following the number of cases among young adults. What I would say is interesting is that the upswing in cases, as I was mentioning, is that some have been associated with bars and restaurants, but I don't think you can pin it all on, quote, the hospitality industry and bars and restaurants. I think many of the cases that we've also noted and been reported have been associated with, indoor parties, private parties in someone's house, obviously with a lack of social distancing and so on. So what I would say is that yes, what's happening among young adults, their risk tolerance level and so on is something that I think we need to carefully look at. And I think one of the key things that we're also doing in public health is engaging with behavioral scientists. I have a little bit of understanding in terms of behavioral science and sort of what are the drivers, what motivates people to undertake certain actions, but I certainly would defer to the behavioral science experts and also I think the risk communication experts. I think between those two sort of expert groups, they can give us the tools, myself included, in terms of how best we might be able to reach young people using the sort of the messages that would resonate with them and so on, but also using the right platforms. I'm certainly aware my kids tell me, say, hey, Dad, I know there's a certain audience that might be watching your press conferences, but, the young folks may be actually more prone to use YouTube channels and, other social media in terms of, quote, getting their messaging and their news. So I think even as governments and public health officials and others, we need to look at a wide variety of platforms in different ways to hit the different parts of the general population.
And I did watch you on the YouTube channel. I think it was Pod Logical that you did a number of weeks ago. But it does seem you're calling this a temporary blip, but we've seen this in a number of provinces. I understand what you're saying about it being related to indoor parties, but that still goes back to what you're saying about sending a signal. And also when we look to our neighbors in the United States, where we're seeing a huge exponential growth there, where a lot of places reopen too early, what makes you think we're going to be able to avoid any kind of exponential growth here in Canada as we reopen, even when other chief medical health officers are mentioning that now?
Well, certainly, your point about what's happening in the United States, to us south of the border, I think is a cautionary tale. I think all of us in Canada, I think the general population, certainly public health officials, are looking very carefully, and I think with some alarm as to what's happening down in the United States. I think what I can say is that in terms of specific measures, what we could or should be taking, we're certainly monitoring the situation with respect to the epidemiology very closely, as I've mentioned. At the end of the day, it really, I think, comes down to what's happening at a very local level. For example, here in the city of Ottawa, I listened intently to what Dr. Etches, the medical officer of health of Ottawa, is saying in terms of her noticing sort of the upswing in cases, young adults, and so on. And so I think what measures could or should be done in the city of Ottawa, tailored to our situation here. I think the general population here in Ottawa should listen to what she says. I can speak broadly for what's happening across the country, but at the end of the day, it's really, I think, very important to stress that people should listen to their local public health authorities in terms of what they're noticing, what they see as the hotspots, what are some of maybe the things that need to be adjusted in terms of measures. So that's one point. The other point I would say also is that I think in Canada overall, Canadians, I think, have been great in terms of following public health advice. Certainly when it comes to things such as the use of face masks in terms as a very easy to do general population measure. I think we've been fortunate in Canada that we haven't maybe seen I call maybe the politicization of that in the United States, and that's something that between that and also I think just generally appreciating the advice that comes from experts, but also from their political leaders, their elected officials. I think overall, I think it's been a great, credit to I would think just how the political system is working in Canada. You've got provincial premiers maybe coming from different parties. You've got the federal government. I'm not a politician, but I've noticed and admired that all of them seem to be getting together. We all recognize we're in the same boat. We need to be, as they say, rowing in the same direction. And I think that's also been a very positive plus for what's happening in Canada. And I think it bodes well, hopefully, for where we go in the future.
And if I could just build on that, look at the way in which provincial and territorial governments have been consolidated and cooperative with the federal government throughout this pandemic. To me, that is the most salient example and perhaps difference between our country and other countries, that we have come together at the provincial and federal levels to develop and agree on an approach forward. And that has led us to, in particular, a $19 billion Safe Restart agreement between the federal government and the provinces. And the purpose of that Safe Restart agreement is essentially to allow the provinces and territories to safely reopen their economies. And that level of cooperation, in my view, is unprecedented and really needs to be identified and called out as a positive for Canadians across the board. So what's in the Safe Restart Agreement? Things like sick leave, provision of PPE, testing and tracing support, childcare, healthcare, support for vulnerable populations. That's systemic, broad-based support that protects Canadians. It allows, for example, people to take sick leave when they are not feeling well from COVID-19 and other issues, health issues. So it's really important to realize that there's a cooperative effort going on in Canada that we don't see south of the border or in many other jurisdictions.
Hi, Crystal Logue with Global News. I'm kind of following up on what my other colleagues in the room were saying, but Dr. Njoo, you just said there has been a steady rise in cases over the past days and that you will be looking into strategies. My question is, what specifically is the federal government doing to help slow this spike?
Well, I say at the end of the day, certainly the provinces and territories have the best finger on the pulse of what's going on in their local jurisdictions in terms of monitoring the epidemiology, determining what might be the source of the various spikes or clusters of cases, and then having hopefully the right capacity and the measures to actually address the situation. From a federal government perspective, we've always been there in terms of surge capacity. Certainly for some of the outbreaks that some of the provinces and territories have been dealing with in the past several months, we've been there with technical expertise, be the field epidemiologists. We've helped coordinate resources in terms of how best to deal with specific shortages of specific types of, I would say, capacities. And then certainly one of the things that we've looked at and we're still offering is that it doesn't seem to be as big a need as before, but we have a whole inventory. The federal government, I guess, inventory of human resources, contact tracers, for example, and certainly the provinces and territories, if they need, based on a specific outbreak, need that specific resource, they've certainly been welcome, and they have called us in terms of, hey, can you give us, X number of, live bodies, contact tracers to help us manage our local outbreaks. So those are the type of examples of how the federal government is supporting the provinces and territories.
As a follow-up, in light of the increase in cases the past couple of days, what is the threshold or trigger for another lockdown, and what are your concerns about this uptick in cases specifically?
I think, if you look at the uptick in cases, I think you have to look at, relative. I don't want to compare us to the United States, where we're looking at it, and I think, rightfully so, where we're looking at the fact that, we've been averaging on a daily basis 300 cases per day. Then, for the, maybe the last week or so, it's been 350 cases a day. Now we're a bit concerned because it's about 400 cases a day across the whole country. look at the numbers south of the border. They're dealing with numbers that it's hard to comprehend here. 60, 70,000 cases per day overall in the United States. There's certain states, in the tens of thousands. So I think it's something we don't want to minimize or say it's nothing. It's something we need to keep an eye on. But certainly at this point, having gone through what we've gone through through the winter months, certainly I think both public health and the healthcare systems in each of the provinces and territories, I think, have gone through the experience. They certainly had sort of, I think, lessons learned that they can apply, and certainly the understanding, expectation is that they would be able to look at and address any situation that is now evolving. And we at the federal government level, in terms of at least from the public health perspective, we're always there to support them as appropriate and necessary.
I would just add that from the broader federal government standpoint, our goal is to support the provinces and territories in the first instance with regards to frontline healthcare workers and the provision of PPE there, but more broadly now in terms of the economic restart, to be able to have support that is available to other sectors of our economy and in particular essential services.
Merci. Je crois que nous avons une dernière question au téléphone. Operator, may we have the last question from the phone, please?
Absolutely. Thank you. The next question is from Sarah Morelli from CBC News. Please go ahead.
Hi there. Just following up on the questions about the uptick in cases in BC, Alberta, the large one-day increase in Ontario. Dr. Njoo, at what point do health officials need to become seriously concerned? What kind of sustained increase in the number of cases do you think we need to see when you think that provinces and territories need to start dialing back some of the reopening rules and reverting to previous phases? Is it an increase over several days, several weeks?
Thank you for the question. At this point, as I mentioned before, we have the Special Advisory Committee, which includes obviously all of the Chief Medical Officers of Health of each of the provinces and territories and ourselves here at the Public Health Agency of Canada, and as well as other federal officials. We meet on a regular basis, and I think at this point I can't give, there's not a hard number or a hard metric you would say, yes, exactly at this point. I think the situation and the context differs from province to province. Just to give you an example, what might be a sort of a trigger or a certain, I think, surge in cases, let's say, in the Atlantic provinces and their sort of tight Atlantic bubble right now would be maybe a different, I think, approach as opposed to, let's say, a large province like Ontario. And even in Ontario, as you can see, even with their sort of opening up, it's not, at the same time, all at once across the province. They recognize that there are also regional differences even in the province of Ontario. And so, what happens in Metro Toronto has been different, maybe in the way it's rolled out compared to the city of Ottawa. So I think, as I've mentioned several times, it really then comes down to what happens at the local level. I think, I think the strength of public health in Canada is really sort of the infrastructure, what happens at a local level with the local public health officials. It's not really for me at the, quote, national level to dictate and tell them what they could or should be doing. I think they have it well in hand. Certainly, I think that the citizens, residents of each of their I say local jurisdictions, I think, are very familiar with the local medical officers of health, as well as obviously the provincial chief medical officers of health. And I think, as I mentioned before, that they should be taking their cue in terms of if there is something to be done, if there is maybe an adjustment to be made in measures at a very local level or even at a provincial level, that they should be listening to their local and provincial public health authorities.
Just a quick follow-up. You mentioned, Doctor, the opioid crisis in the answer to another question some time ago. We know the Premier of BC, John Horgan, recently said that he supports this call by police chiefs in Canada to decriminalize the possession of small amounts of illicit drugs for personal use. As he says it's the best way to battle addiction. You no doubt know that province is seeing a huge spike in the number of overdose deaths, and the Premier is now calling on the federal government to heed that call and follow suit. So I guess my question is, will federal health officials consider decriminalizing drug possession?
It's Dr. I can certainly speak only from, I think, a pure public health perspective. I would certainly say that certainly understand where Dr. Henry's come from. We've had conversations, discussions, even at sort of among chief medical officers of health in terms of drug use, harm reduction, all of those tools and measures that we're thinking about in the public health space have been sort of well established. We've known for many years some of the benefits in terms of what we might call a suite of harm reduction tools, and we recognize that it is a sort of a one tool in a toolbox, if I can use that expression, that there are a whole range of other measures that could come into play. And as you mentioned, the issue of sort of the legality, decriminalization and so on, that's certainly another important aspect, but that's something I think in terms of a decision to make, that's really made by, I think, governments, elected officials, and I think public health officials, Dr. Henry included, in her jurisdiction, ourselves here at the federal level, we would give our best advice to elected officials as part of the mix, and then they will take that advice and make their decisions as appropriate.
Merci à tous et tous. Thank you all. That so concludes our news conference today.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.